Hello everyone. This is Tony,
and Bella.
and we are from ShameEma sales team. And thank you very much for your participation over today's webinar. And I will just quickly introduce Dr. Shameema Damree, and she would start her presentation for today. And Dr. Damree is a director of medical aesthetic and wellness in UK, and as well as London-based aesthetic medical practitioner with a focus on innovative biotechnology and medical devices in the field of anti-aging and cosmetic dermatology from South Korea.
Our partnership started for 4 years now, and I'm extremely excited to introduce her to you all and share today's topic. Today's topic is advanced clinical treatment using Vivace with exosomes in hair restoration. So now let's hear her speech and please applause to her.
Good morning, everyone. Thank you so much for the very kind introduction. And I will be speaking today on behalf of ShameEma about the advanced clinical treatments using Vivace with exosomes in hair restoration and in cosmetic dermatology. As I've been introduced before, I am a London-based aesthetic medical practitioner with a focus on curating the South Korean market to bring innovative biotechnology and medical devices in the field of anti-aging and cosmetic dermatology from South Korea to the UK. I have been using the Vivace device for the past 2 years in my clinical practice, and I have been very impressed with the high specifications of the device. The Vivace device is one of the latest generations of microneedling radiofrequency. It has a strong safety profile in that it has CE and FDA certifications. It has clinically superior results with minimal pain and minimal downtime. The results are immediate when you use the Vivace, but also in addition, they are cumulative over the multiple sessions. Vivace is a multi-award winner and has proven itself over the past 3 years, having won over 8 awards in the United States. In 2021, it has won the Best Microneedling RF Device, but it has also won these awards for Best Skincare Device and Best Innovative Device in 2020, 2019, and 2018. Vivace has been adopted by many renowned US-based plastic surgeons and dermatologists to use the Vivace to offer the best of clinical results to their patients. The clinical indications of Vivace are for minimally invasive hair restoration, for facial rejuvenation, in skin tightening of the face and neck, for resurfacing of the skin, in minimization of the pore size, and improvement in skin texture. It can also be used in inflammatory skin conditions, such as acne and folliculitis bulbarae, for the treatment of scars of different etiologies, such as acne scars, keloidal scars, and of traumatic origin. Vivace can also be applied for body treatments to treat stretch marks and for skin tightening of the abdomen, thigh, and underarms. Vivace has world-leading specifications with a high output of 70 watts bipolar radiofrequency. I love the 36 ultrafine gold-plated needles of 0.3 millimeters in diameter. Thanks to its ultrafine diameter, there is minimal trauma that happens to the skin, therefore minimal downtime. Vivace has 31 multi-level precise depths ranging from 0.5 to 3.5 millimeters at an increment of 0.1 millimeters. It has a smooth glide robotic handpiece, a chevron circuit control flow, a very unique 3D precision parameter that can be applied for all Fitzpatrick skin type, even the dark skin type, such as brown skin or black skin as well. It also protects the epidermal nerves, causing minimal pain. It has a variable pulse duration ranging from 100 to 800 milliseconds, and it is also equipped with blue and red LED. The mechanisms of actions of the blue and red LEDs are depicted below. Red LED, as we know, is used for skin rejuvenation. Red LED promotes the production of collagen and elastin, thereby improving skin elasticity and texture. Blue LED is anti-inflammatory. Blue LED kills the P. acne bacterium and other organisms related to other inflammatory skin conditions. Now I will be talking about one of the hottest topics at the moment in the field of aesthetic medicine is exosomes. Exosomes are the rising star in regenerative aesthetic medicine. So what is an exosome? An exosome is a stem cell derived, it's stem cell derived, and it is a key mediator of paracrine effect. Actually, it is a cell-free based therapeutic that have very strong regenerative and immunomodulatory effects. Exosomes, they are the avatars of the stem cells. They can carry the growth factors, the anti-inflammatory cytokines, the genetic material to your own skin cells and activate them so that they can produce more tissue regeneration and immunomodulation. As you can see in the microscopic view, you can see the exosomes are the tiny particles that are in green, and the human dermal fibroblast, which is the skin cell, will absorb the exosome and activate itself to produce more collagen and elastin. Exosomes can be used for anti-aging purposes, to treat dermatological conditions, and in hair restoration.
So now we are in the first section. Dr. Damree will be introducing her cases about hair restoration. Let us hear. Thank you.
So I will now be introducing my hair restoration cases using the combination of Vivace and exosome. This is a very innovative therapy, and I have devised a protocol, and namely the DDIP protocol. I will be explaining to you, first of all, to understand the mechanism of action of Vivace on the hair regrowth. Vivace, as we know, has radiofrequency. The radiofrequency induces the production of cytokines, growth factors that are associated with hair growth. The microneedles in the Vivace, the 36 gold-plated needles, will induce the microtrauma to the scalp. It will trigger the production of additional growth factors, therefore promotes hair growth. We, together with Shenbi, we have worked to be able to have the specific setting for hair restoration, and this has been validated by the director of the Hair Restoration Society in Korea. So the parameters are 2 megahertz, to use it at 100 milliseconds, to go to a depth of between 0.5 to 0.8 millimeters in diameter, in depth, because this is where the hair follicles are located, and to use the insulated tip so that not to damage the shaft of the hair. Now, the advantages of using the combination of Vivace and exosomes is that you will get the synergistic effect of microneedling RF with exosomes. The methodology of the treatment comprises of 5 to 6 sessions of Vivace at 2 weeks interval in combination with point-by-point injection of exosomes. So I will be playing a short video for you, and that will outline the treatment.
Hi, I'm Dr. Damree, and welcome to the London Exosome Clinic. We are the sole exclusive distributor for exosome-based products in the UK. We are specialized in the use of exosome manufactured by Exocobio, namely ASC, HLRV, and ASC, SLRV, for minimally invasive hair restoration and skin rejuvenation. I will be demonstrating to you the DDIP protocol step by step today. Step 1 of the DDIP protocol involves the use of a chemical peel. So today I'm using Mesopeel that contains 10% glycolic acid.
So now I will show you how to apply.
I am now demonstrating the application of the Mesopeel onto the scalp. Apply the Mesopeel evenly on the scalp, directly on the scalp onto the area that needs to be treated.
So we usually leave the peel on for it to act for 40 minutes. And afterwards, you can neutralize the peel. Usually it's rinsing off with the lukewarm water or using neutralizer.
Step 2 of the DDIP protocol involves the use of Vivace, which is a microneedling RF device. The tip of the Vivace comprises of 36 gold-plated needles. The machine has been calibrated to the specific settings for hair restoration, and I will now demonstrate to you how to use the device on the scalp. This is ASC HLRV, a product from Exocobio.
So as you can see, it has 10 billion exosomes. The product, it contains numerous growth factors, peptides, amino acids, vitamins, and minerals. So what we do is we can combine the product with 3 ml of lignocaine, and the product will dissolve completely with the addition of lignocaine. So you draw up the product onto the in the syringe, and what I use is you can either use a 33 gauge 4mm nanoneedle to inject it in the scalp, or we can also apply topically on the scalp, for example, using a derma roller, or just apply it after we've used the Vivace. Now I'm demonstrating the point-by-point injection technique to you. But as I've said, when we've used the Vivace, we would have already created thousands of small channels in the scalp. So we could also topically apply the product. Afterwards, to finish off the treatment, we use low-level light therapy for 20 minutes with a combination of mixed red and infrared light. The aftercare is your choice, but I use a combination of hair regrowth serum along with a hair regrowth shampoo that the patient can use 3 to 4 times a week. All right, so now we've watched the video. I will show you some of the cases that has been performed in my clinic. The first case for minimally invasive hair restoration. This was a 28-year-old male with a diagnosis of androgenic alopecia and a past history of having hair transplant surgery 8 years ago, performed in India in the crown area. At the time that I saw him, he had significant hair loss in the crown area and very thin hair. We applied the DDIP protocol and performed 6 sessions of Vivace in combination with exosomes and low-level light therapy. As you can appreciate, in this, after the fourth treatment, we had an increase in hair loss, increase in the hair density, and the thickness in the crown area. This patient was highly satisfied with his results, giving it a score of 9 out of 10. So the Vivace parameters for hair regrowth, these are the settings. And, Tony can share it with you later as well. And this is another case, again, where we have performed a combination of Vivace with exosomes on this lady who's had significant hair thinning over the crown area. We've done 5 treatments, and again, we've seen a significant improvement in the number of hair follicles that have grown back. The hair is denser, and also the patient was highly satisfied with the result. And this is one of the other success stories from the clinic as well. And again, combination of Vivace and exosome, and as we can see, the hair thinning has significantly improved. There's more hair, denser hair. So these 3 cases clearly demonstrate the superiority of combination of Vivace and exosomes for hair regrowth. Female hair pattern baldness actually is very difficult to treat. This lady presented with hair thinning and alopecia in the frontal hairline. And we've used combination of Vivace and exosomes. And as you can see, not only there was improvement in the hair growth, but the quality of hair had also improved. And this patient, again, was highly satisfied with the results.
Okay, thank you for sharing, Dr. Damree, about your hair restoration. So first section has been done, and there's a summer question again. It says Ronaldo, Dr. Ronaldo Cantiano, asking about the Vivace's hair restoration parameter. So Dr. Damree, I think you already simply can answer them. So please check on the slide.
And also, Tony will be able to send to all the distributors, and the distributors can share with the doctors the parameters that has been recommended.
Sure. After the finish of your presentation for today class, and then I will share all the presentation file.
Okay, that's fine. So if you can, we should move on to the next section now, Tony.
Okay, just in case anybody who has a questions for more, we will want you to leave your messages, then we will answer them afterwards. Okay, Dr. Shameema Kapoor, maximum of how many sessions are required, and what's the gap between 2 sessions?
All right, so for hair restoration, it really depends on the cause of the hair restoration, and everyone will react differently because everyone's hair grows at a different pace. But usually we have found in between 6, roughly on average, 6 sessions. Some patients will require less, some patients will require more. So between 5 to 8 sessions is what we require to have these kind of results. And also the time interval is 2 weeks. Actually, the Vivace device is so good with minimal downtime. And the advantage of the scalp compared to the face is that the face is, you can see the downtime is longer. The scalp, the thickness of the skin is much thicker. So actually, even if need be, you could do it also every week as well, because the patient would have already recovered anyway.
Okay, there's another. Are exosomes used before or after the session?
Yes. So ideally, what we want to do is we want to do the microneedling, use the Vivace first, then the exosomes.
Okay, another one is a topical aesthetic cream required for hair restoration?
Okay, so the Vivace microneedles is very fine. So most of the time, depending on the patient's sensitivity, some patients we can use topical anesthetic and some patients don't require it. So just depending, we have to gauge and see what the patient's pain tolerance is. But for most of my patients, I haven't used topical anesthetic.
Okay. Any contraindications to the treatment?
No contraindications so far. I mean, we have to abide by the contraindications of the Vivace device. So as I understand, if we have a defibrillator, if we have a mechanical device in place, then we might not use the Vivace. So that's the contraindication for the Vivace. And the contraindication for the exosomes, actually, if the patient is undergoing any active treatment for any types of cancer, malignancy, then we should not use exosomes. But these are the only two indications that are the real contraindications for the treatment.
Okay, why do we need MNRF? We can also do a dermal roller and do other part of a procedure.
That's right. So Vivace has the advantages, as I've said before. I'll just go back to the screen. Vivace is superior to dermal roller because, for example, if you take a microneedling device, it has only the microneedling, and also the quality of the microneedling is not good. Here we have gold-plated needles, very fine, that will not traumatize the scalp, not cause more trauma than needed. But the Vivace also has bipolar radiofrequency. Bipolar radiofrequency will make the hair grow faster than usual. So that is one of the indications as to why Vivace is superior than using just simple microneedling.
Okay, there are so many questions, Dr. Damree.
Yeah, just go through a few and then we'll go to the cosmetic dermatology. I will take one more, then
Okay,
we can answer them by email.
Dr. Damree, can you choose one? There's a lot of question about PRP, so
yes.
How about this question? Can we use a PRP or mesotherapy topical with the Vivace and on the scalp?
Yes. So as we know, we can use any hair stimulating growth factors, whether it's mesotherapy or PRP. But the latest in the field of regenerative medicine is exosomes, which is 1,000 times more powerful than PRP or mesotherapy. So that is why I am presenting this innovation. But of course, you can also, after doing the Vivace, apply the PRP or meso. But you might not get the same result. So that's the key, to have, as this picture shows here, after 4 sessions, this is quite extraordinary to have these results. So that is why I am presenting this for the innovations in the field of hair restoration.
Okay, thank you for answering questions, Dr. Damree. There are too many questions, but actually we will keep it noted and then put it onto our document. And then we will answer them and sending out the answers by emails to each distributors so that you will be able to share each other. So let's move on to the cosmetic dermatology for the second session. Dr. Damree.
All right, so this is the second part of our webinar where I am talking about the innovative use of Vivace in combination with exosomes in the field of cosmetic dermatology. This is a case where I have used a combination of the protocol for anti-aging purposes. So this patient is a 55-year-old lady who presented with global signs of aging. We used the DDIP protocol. We performed 5 sessions of Vivace in combination with exosomes. The results that were obtained were skin rejuvenation, tightening of the skin, increase in radiance, and even pigment correction. And you can see the results are very natural, but you can, especially around the crow's feet and the nasolabial fold, you can really see how the skin has been rejuvenated. And that is thanks to the combination therapy. The other case is, this is a complex case. It's a 57-year-old lady with mid-face trauma post a handlebar accident. At the time that I saw her, she had a mid-face laceration. She had skin loss at the site in the mid-face, but also loss of facial adipose tissue. So the aims of the treatment was to correct the facial trauma, minimize the potential risk of scarring, and even correct the pigment in her mid-face and rejuvenation. So the protocol that was used was 5 sessions of Vivace with exosomes. And you can see here, there was rapid wound healing. We corrected the facial defect and we minimized the risk of the scarring. But at the same time, overall, the skin and also the neck as well, the skin was rejuvenated. So this is a very good and successful story. So now I will be sharing some histopathological slides about both Vivace and exosomes so that you will understand why together the result is superior. So this shows the histopathological slides for Vivace. So how does Vivace works? It is basically a fractional microneedling RF device. The mechanism of action is it causes point-by-point coagulation in the dermis, as you can see in the photograph. And what it does, it induces neocollagenesis, which means you're going to increase the amount of collagen, the amount of elastin being formed in the skin, thereby causing a faster wound healing. And as a result of that, you will get the skin tightening and the reduction in the depth of the wrinkles. These are the slides for 1 megahertz and 2 megahertz modes of Vivace. Now, what happens with exosome? As I told you, so the exosome is the latest in the stem cells. So this shows that we have a negative control, which is a de-epithelialized skin that hasn't been treated with anything. And the other slide shows the area where we have treated with exosomes. As you can see, there has been an increase in the thickness and re-epithelialization of the skin. And it's the same thing that we see when we apply exosomes to the skin. We have increased wound closure. The skin basically is healing faster. Now you can understand why when we will combine both technologies, we will get a far superior result. So now I will be showing some other cases which are quite difficult and challenging cases in dermatology, where I have used Vivace and exosomes. The first is the anti-inflammatory effect of both Vivace and exosomes. So there in the literature, there hasn't been many cases where we have used Vivace to treat folliculitis barbae. There has been a couple of case studies that have been published in PubMed. So one of them, actually, I treated a patient who is 33-year-old with folliculitis barbae, and his condition was recalcitrant to the use of very strong antibiotics and Roaccutane. He suffered the skin conditions for 2 years. So I applied, he did 5 sessions of Vivace along with exosomes. And you can see the significant reduction in the pustule formation. His skin was brightened in the end, and overall the skin health had improved. This is, in my clinical opinion, this is outstanding result, because you can see the improvement in the quality of the skin is phenomenal. So the parameters that I have used in folliculitis barbae, these are the specific parameters that I have devised from some of the clinical cases, and Tony will share them with you later. And these just demonstrate some of the technicalities of the device that we've already gone through. Now, last but not least, the use of this combination therapy for body treatment. One of the very challenging conditions to treat is stretch mark. This lady has had these stretch marks around her umbilicus for more than 10 years. So this happened after she gave birth 10 years ago. And as you can see in the before pictures, the stretch marks were quite broad in the diameter. And this is phenomenal result. And you can see the after picture is only after one session of Vivace and exosome. You can see that stretch mark had reduced by 50% approximately. And even they are not so pale in color anymore, almost that they have been revascularized the area. So she continued to have the treatment, and in all we've performed 6 sessions, and she was very happy. So exosomes can be used for that. These are the parameters for the stretch marks. So in summary, the combination of Vivace and exosome is the innovation in the field of regenerative aesthetics. Always combination therapy will win and will have the synergistic effect. So thank you very much for your attention, and I will be taking some questions now.
So everybody, we just haven't done a second session of facial treatments, and Dr. Damree will be able to answer some of the questions for you. So if you have any other questions, please give us.
Or even if you have the questions on the hair, I can answer them.
Let me check. Was it done after the folliculitis healed and any adjunct treatment was given?
No, no adjunct treatment. So the patient had stopped the antibiotics roughly 6 months ago and Roaccutane, so nothing at all. Just Vivace using the settings, the parameters that I have said, but we have done it at 2 weeks intervals and 5 sessions, and used the blue LED in the mode, but also with the exosomes as well. So that is really showing the powerful combination that these two really are.
And another question is that what are the active ingredients that combat a hormonal component of a male pattern baldness? Baldness.
So say that again, sorry. What are the?
What are the active ingredients that combat hormonal component of male pattern baldness?
Okay, so the I guess that is we'll have to clarify that question to see if they are asking for the Vivace or the exosomes, and because it's quite lengthy, the answer we can respond to that on the email. So that'll be best. The next question, please.
Okay, some of people are asking about how they can provide the exosomes. So I will take all the inquiries about exosomes, and please just send me the email, then I will collect them and share to Dr. Shameema how to provide. And there's another question. Let's keep going. Parameters for stretch mark, please. And I think it's already given. So
yes,
on this slide right now.
Yeah.
And for skin tightening, which tip do you use? The insulated or non-insulated tip?
Well, because we are based in the United Kingdom and part of Europe technically, so we only legally have access to insulated tips. And this is one I've used in all of the cases. But I think the insulated tips are good, especially here for our patients, because they want no downtime. You see, this is basically after the treatment. So actually, I like the insulated tips, because there is no point to cause more trauma than we should. The non-insulated tips are good for scars, but skin tightening, insulated tips.
Okay, there are many others, but actually, I think we will just stop here because we cannot answer them all single questions. But don't worry, we will collect them and then ask to Dr. Shameema, Damree, and then we will be able to answer them to you. So thank you very much. And after the presentation, I'm going to download our video of today's webinar, and then we will able to share to you as well. So I think it was helpful to you, and hopefully you can have a use on your cases and share to your potential Vivace users, and even the users who are able to do the hair restoration or stretch marks and so on. And of course, we will look on and we are waiting for the people who would like to share even Dr. Shameema's cases as well. So maybe if you're able to share your cases, and we are more than happy to receive and have a discussion for other webinar. So thank you very much, Dr. Damree, and we will look forward to have a more opportunity. And thank you for your time.
Okay, thanks everyone. Thanks so much for Shameema for having me and giving me the pleasure of presenting to the webinar. And any questions that you have for the doctors or the distributors, please forward to Tony and we'll work through it. So that'll be good. Okay, thanks very much. Have a nice day. Bye-bye.
Bye-bye.
잠깐만.